Blog Talk Radio.
Hi, and welcome to Linda's Conscious Talks, and I'm your host, Linda Summers, and we've got Dr. Dubroff back on our show again today. We've got a great show for you. The topic is Cranial Sacral Therapy, Increasing CNS Circulation and Function. And I'm not going to go over his bio because if you haven't listened to any of the shows, we've had 3 shows, and you go back and listen to them because there's a wealth of information. We've got amazing topics. June 1st was naturopathy medicine, how we promote the body to heal itself. June 8th was the body can heal itself, transforming the placebo effect into real medical treatments. And June 15th was classical homeopathy, transformational healing. And like I said, it's just there's just so much information, and I can attest. Well, I should bring Dr. Dubroff back on the show. Hi, Dr. Dubroff. How are you?
Hi, Linda. How are you?
Great. I was just getting so excited. I was like, I just want to start talking about in working with you. And I thought, gosh, I should probably bring him on board so we can at least answer. I say I am so impressed that I know I've worked with you, a little bit before, well, not actually a little bit, but to some extent. But now we're really kind of diving into something a little bit deeper and really going into what we talked about last week, the homeopathy. And I will have to say, for anybody that's listening out there, this is a person who is so passionate and so thorough that it shows in your work. I mean, I didn't realize to the nth degree that when you start really diving into not just the symptoms of what's going on, like the runny nose or whatever, but really, as we spoke about in the one show, and I believe it was in the very first show, Naturopathic Medicine, as to lifestyle, diet, and all such things like that. But emotion, I mean, all of that plays such a huge role. So I just want to say, I'm really, really, I'm just honored to work with you, and your passion does come through, and you're so thorough. So it's amazing.
Yeah, and talk about the whole, getting to emotions. What I love about homeopathy and cranial sacral therapy is not only does it not need a diagnosis, which is typical of conventional medicine, a lot of natural medicine, because it's looking to kind of share space and find very similar medicine. It's best to listen to homeopathy more so that you know what I'm saying for audience-wise. But it allows really it allows a different angle from that emotional perspective and stuff, and how it all ties into physical symptoms. And that's the whole idea when you can bring that whole angle and bring in all the functional medicine and biochemistry along with treatments like cranial sacral therapy and homeopathy. You can just really get an amazing, very complete response. And that's why I love it and why I am so passionate about it, because it's very exciting to see that happen. So.
Yeah, and it shows your work, and I've even had the experience with you with cranial sacral therapy, which is really amazing. I mean, it's something that is very much internal as opposed to external, and if you're really tuned into your body, you can really feel what's really kind of happening. So it's definitely, you mentioned about the client-doctor connection through the subtle body rhythm, which I find very fascinating. Mm-hmm.
Yeah, it's very interesting. And I think we all know about this, and most people, I think to some extent, like cranial sacral therapy, especially once people figure out what it is, which is a form of, like you're saying, keying into these subtle body rhythms, they might be suspicious of it. Well, what is that going to do? What is that? But just speaking to those subtle body rhythms, I think all of us are familiar when especially in significant relationships, and you're lying, and a lot of times right after intimacy, you can, and other times, I know me when I'm sleeping, you just turn to someone and you can feel this, or you have your hand close to them and you feel this pulse inside them, and that's the subtle rhythms I'm talking about. I think most people probably would be hard-pressed to say, oh, well, I've never felt that before. At least I would imagine, or maybe I'm just extremely sensitive. But I think if people aren't familiar with it, they might misinterpret or they might not be completely conscious of it. But it's these subtle body rhythms that when we key into things, really when we just listen to things, we can really start to feel. And it does, I think it's important to acquire that sensation, but it's something I think everyone does all the time, so sometimes they're familiar with it, that there's an odd feature there, and then other times they just see it as the other person. But it can really open up into all sorts of things and all sorts of depths of experience and sharing of those rhythms. And just to give that quick explanation, for me, the subtle rhythm, cerebral spinal fluid from a structural relationship and, preventing adhesions in central nervous system structures such as cranial bones and sacroiliac joints, which is the sacrum is the end of the central nervous system, where the central nervous system is encased, of course, outside of the vertebrae, all the way up to the cranium, which once again encases the entire central nervous system. Anything that comes out of the vertebrae is the peripheral nervous system and not encased. But also the nervous system is an electrochemical gradient that propagates down myelin sheath, which probably people don't know what it is, but myelin sheath is it's sort of like when we think of rubber on tires, you think, electricity can come down or lightning can come down and it will ground down. Myelin sheath is similar in that it's this cushiony material that surrounds nerves, and the impulse, this propagation of an impulse down the nervous system jumps over the myelin sheath. So, and so basically, for me, the base of cranial sacral therapy in much way is wherever you have an electrical current, you have a magnetic current working around it. And while the magnetic current isn't exactly the electrical current, they just have a relationship, and one follows the other. And therefore, our magnetic currents, from a scientific perspective, interact. And I think that's what happens to some extent when you key into someone is you're in their space. That's why I think for kind of average person experience, when they're not thinking about it, it's usually intimacy, because then you're really seeking that rhythm with someone. But in reality, it's always there, and all you got to do is take the time, and you can feel it. So, cranial sacral therapy, both structural and bioelectric or electromagnetic.
So when you say cranial sacral, because I didn't even really know that, so the cranial is the aspect of the back of the neck, the head, and then the sacral is down to the vertebrae. Is that what you're saying, or did I misunderstand that?
It should be cranial vertebral sacral, because the central nervous system is encased in the cranium, which is made up of all these different bones, like the sphenoid, the frontal, the temporal, the parietals, the occipitals, all the nasal bones that surround and create the sinuses and breathing patterns and such, and then through the vertebrae, and then to the sacrum, which is, I was about to say evolutionarily where the tail might have been. There's some appendage there that would have been a bony structure of a tail in another species that has decreased through evolutionary change in the Homo genus,
Right.
But so that's what you're doing, is you're connecting and feeling different places and movements and seeing where the adhesions are in different cranial structures and allowing that to flow, which increases cerebral circulation, and cerebral spinal flow enhances, and therefore you kind of wash out the brain and allow it to, work better, function better, flow better.
Right.
Yeah.
Well, there's two questions I was going to ask you about how the treatment brings such wonderful results to the brain trauma, or to brain trauma, depression, pain, and more. But before I ask you that, in the title of the topic, increasing CNS circulation and function, what is CNS?
It's a central nervous system. The body has lots of different communications.
Oh, yeah, which is so true.
Yeah. Central nervous system, and the PNS, which most people haven't heard of, is the peripheral nervous system, which are just neural tissue or fibers coming out of the central nervous system encasement around those bony structures and touching out and reaching out to every tissue in the body.
Right. Well, because I know
and
that
therefore, if you change the dynamics there and you change the structure, release the structure of the cranial bones and the adhesions with the surrounding fatty tissue, which is the central nervous system, you can then not only affect changes within cognitive and higher reasoning and such like that, and brain injury and trauma, you can also spread it out to any function in the body, because there's two major forms of communication in the body: the central nervous system and the endocrine system. The endocrine is a hormonal system that regulates function and form.
Really?
And then there's the central nervous system, which kind of breathes life into the whole matter. It's electrical, output of the system. It's kind of what brings life. And it's not literally what brings life, but if you think about it, it's really fascinating that you can generate this electrical impulse and propagate it here and there throughout the body, and lead your body to decide if you want to walk here or talk like this, or whatever number of expressions or organ functions that entails in it.
Right. Well, it's so interesting because it really does. I mean, I just know I love cranial sacral. I mean, ever since I had started getting it, it's like I forgot massages, because this was so relaxing on my nervous system to be just like, But I didn't know the whole, everything really behind it. I just knew it really felt good. So it's just really interesting how it really it makes you think that, wow, like we really are energetic beings. I mean, you know that, but when you start really, when you're diving into this in such a way as you're speaking about it, it's like, wow, like that's how everything, all the energy and how it's moving, and being able to feel another person. And because I'm sure people have, I mean, I'm sure I have, but really never even thought about it or didn't really know what it was.
Of course you do. Yeah, I mean.
Yeah.
I mean, something that I always wonder about, and I'm really quite sensitive, and so I can pull up these rhythms, I can pull up these feels, I can within those sensations and those subtle rhythms is somehow you can experience, or at least I can, some elements of what the person's experiencing. And that wasn't the first thing I meant to say, but what I was saying, hopefully it's just my train of thought. But hold on, I'm sorry. When you think of someone, you feel a sensation that you associate as them. And sometimes you can have a conversation with yourself and include an individual. But other times you just sit back and you feel a friend or an individual, and you feel them. You're like, oh, I am so thankful for that connection. But that connection, that feeling that you're having is the sensation of them, as opposed to a logical conversation about their traits. And through that, I think when people really learn to hone into that, especially in this kind of scenario, you'd be surprised what could open up to experience. It's
really?
It's quite beautiful.
Wow. I love that.
Yeah.
That's so amazing. So really for stress, I mean, because anything, I mean, the depression and pain. So how can, I guess it all really boils down to the central nervous system that really helps with the depression, it helps with the pain. I mean, I know I've experienced that myself, but I mean, and maybe you've really already said something about that, but it just feels like there's so many aspects that cranial sacral can be used for. Yeah,
definitely. And aspects that often, I mean, the central nervous system, it affects everything and anything. So, I have a woman that I'm treating with all sorts of things, and she's something called interstitial cystitis. And I think she's after, I'm also doing classical homeopathy with her, so it's hard to wrestle things free. But she's 70% interstitial cystitis gone away. Now, this is a condition in the bladder that that irritates the bladder, causes pain, causes frequent urination, and is really the only treatment that people ever talk about as effective, and even then when you look at the literature, it doesn't look like it's too effective, is an insertion of, I can't even remember the medicine, I think it's like heparin or something, that you actually insert up the urethra towards the bladder. But you really don't get any results. But here, you're, once again, as we talked in homeopathy, you're stimulating the system to help itself, and you're creating a better flow of that. And I once again, I do think there's an electromagnetic relationship between the two people that further helps things. But it's really just quite incredible because, seeing kind of resolve in interstitial cystitis, every time I see something like this and see something that is getting a great response where you're told it's not supposed to.
Right.
It's just always a miraculous thing. You're like, oh, well, part of you is like, oh, that shouldn't be happening, and oh my God, it is, and can't wait to do it again. So.
Well, that's really why I was going back to the original when I first started the show, was saying how thorough and how passionate and how you dive so deep. And even with this cranial sacral, when you talk about how it's the client-doctor connection, there is such a connection that it's like you're really digging deep into the core issues. When we the very first show, June 1st, naturopathy medicine, is really getting to the core of finding out what's going on with that person. So with this particular person, you've not only used cranial sacral, but also homeopathy.
I've used functional medicine, I've put clinical nutrition things, I've had to take some different supplementations. Mostly on the show, we're talking about like transformative medicine because I'm just more passionate about that. I love that stuff. But it's not the only thing I do, and it's really a comprehensive program, and things need to be met from many different angles. And the more someone does of that, the more they invest. And the more they invest, the more, as we talked at the last show about, transforming a placebo effect and the person can use, the more someone invests in those treatments, sometimes you have to ask yourself, is it the treatment or is it the person's investment? And everything works hand in hand. But that's what I think happens when someone only relies on a pill, is that, they're not getting as comprehensive as they could. And the more they get comprehensive, the more things are going to respond in kind. And, and we can understand that as the placebo effect, in action. But, we wouldn't call it a placebo effect. It's more, the placebo effect shows that we can heal. And the question is, how would we do that, where the placebo effect is kind of a fake form of it, in that someone's being deceived into thinking they might be taking the study medicine when in reality they're taking nothing but sugar water.
Exactly. So what would you say would be the benefit of doing cranial sacral therapy for a long period of time? I mean, we're talking years, once a month for years. What would be the benefit of that?
Quite a bit. I mean, cranial sacral therapy is incredible for a lot of things. I've seen just tremendous results, like you were saying, with depression and anxiety. But also, you do need to maintain some of those treatments, but also the body has a neural net that once it experiences something for a certain amount of time, it can reprogram itself. Or not reprogram itself, but kind of has, everything in the body is based on homeostasis and genetics, right? Your genetics dictate certain parameters that you can move in and out of. In science, it's called genetic plasticity. You have so much movement range within your genetic setting, and therefore, nature and nurture intertwine and act together. And now I'm losing. I guess I'm a little too tired today.
Well, what was the benefit of using this for a long period of time?
Oh, yeah. I mean, your neural net, once it's experiencing something for an extended time, it can reset itself. And once again, that's the beauty thing here, is you're looking for a curative response. You're looking to help the system reinvigorate itself and get itself into a state where it can heal itself. And that's a beautiful thing. And I know that's my ideal in medicine, to see someone transformed. I can do all the I can, I practice as a conventional doctor under a DO. I have interest there. I've done all sorts of supplementation, which is in some way, supplementation in the sense of what's called green allopathy, meaning instead of using just all the typical allopathic medicine, and allopathic medicine is just it's an older term for conventional medicine. You use a green plant, so it's still very symptom-based. But it's, like I said, it's not comprehensive enough. When you bring in those supplementations and you bring in anything from hydrotherapy to classical homeopathy to cranial sacral, prolotherapy can heal tissues, you get just so much more of a comprehensive effect. And then the body can take over from there and rebalance itself and re-exert a better state. And it's hard to know what cranial sacral therapy can't do, because I think that would mean if cranial sacral therapy can't do it, that means the body can't do it. Therefore, more heavy genetic situations like mental retardation, I don't think we're expecting too much results because, we're outside of the realm of the genetic plasticity for that individual and that symptom.
Right. You're so knowledgeable. It's just crazy. It's just amazing. It's just totally amazing. So if someone really wasn't experiencing anything, I mean, anybody's listening to the show and after the show, you have to experience this because it really, truly is amazing. I mean, I can't even say enough about it because I just totally love it, and I would do it every day if I could do it every day. It's something that really is incredible. So if someone really doesn't have anything going on, what would you say? Why would they want to come in and have it done and experience it?
Well, of course, if somebody does, practicality with medicine is what it is. So if somebody doesn't have something that's concerning them, typically they don't come. But the truth is, it's very hard to find a person that doesn't have something. We're imperfect beings. We're biological organisms. I didn't ever finish homeostasis, but the idea of homeostasis within genetic plasticity is you seek a balance point, and that's what I was talking about with the neural net. So if certain circumstances and environmental influences push you to a certain state of health, body will set you there to keep you there so it can maintain energies on something else. It can't just constantly fling about in genetic plasticity spectrum of possibilities. It has to create a balance point and stay there. So, in truth, people might have a certain homeostatic balance, and they very well are very comfortable with that. It's appropriate, if we just want to talk about emotional issues, it's appropriate to seek health and joy in your life. And a lot of times that means not worrying about deficiencies, but that's a homeostatic operation, and it's always, it's always very good to say, well, do I want to try to rebalance my homeostatic place to get to a new point? Once again, though, if someone doesn't have something very, very pressing, it very well can become less of a concern. They're probably not going to find their way to, financial expenditure in that situation. But clearly, the body can always use a balancing point and, helps their susceptibilities and such. So,
well, what is the cost for something like this?
What I do is I have a really great introductory cost. I have a $25 appointment so people can feel it out. And what's great about what I do, because I've actually done forms of this ever since I was about probably 12 or 13. I've been playing with different electromagnetic things. Is I charge only $25 just so people can feel it out. And the thing that's great about what I do is in some of the things earlier, I developed it in such a way as to make sure, because the only way I could trust it was to know that what they're feeling, I'm feeling. And so it's a nice standpoint because it's a very real experience. It's a very real sensation that I can communicate with people while they're experiencing it, and then that will let them know there's something very interesting going on here. From there, it's $65 an appointment if people do, purchase a certain amount of appointments beforehand. Obviously, I'm going to give them discounts and things like that. And I'll work with people, too, depending on finances. It is an ongoing charge as long as they feel connected to something. And I have the treatment time, which is one of the key thoughts there. I'm always willing to work with someone. So.
Right. Well, definitely, listeners, you've got to try it out because you won't regret it. I mean, I can tell you from my own experience with Dr. Dubroff that it truly is amazing. Even if there is nothing going on, it's an experience that your body is just, I can't even describe it. It's definitely experiential, and it feels so good.
Yeah, and I think it is really that homeostatic thing. It helps the body to reset, and that's why I think it works so well for depression, because it just I don't know, it resets something, and it seems to be very effective. That's something that just consistently gets great responses, which is really great because a lot of people suffer from some pretty intense depressions, biochemical depressions. Hard to differentiate between that or just circumstantial, and it really does seem to get great results and bring people a lot of relief. So that's,
I love
that's
that.
an easy thing that you can say, come in for this, depression and anxiety.
Exactly. And like you said, I think we can, there's always something that's probably going on in the body that we probably don't even know about, so it definitely is worth seeing. Well, we got 3 minutes left, so anybody that's listening or would be listening afterward, Dr. Dubroff's website is www.holisticsolutions.doc.com. You can reach him at 949-444-4884, and he does a multitude of things. I mean, there's so many things that he has in his toolbox, so to speak, that, I mean, no matter what your experience, what's going on, he has something for it. He will go to the nth degree to find out what the cause is and really get you on this healing journey. And really that's what this month has really been about, because you'll be back with us on July 6th, that Monday. So next Monday, actually. Yeah, I forgot we're already in July. So, really contact him and find out, because if there's anything, I mean, he will help you with that, and that's really what I have found with the basis of you and really having these conversations and getting a chance to talk with you and work with you, is you really are about helping people and promoting how we can promote the body to heal itself, how we can get the body to heal itself, and I love that. So thank you for that.
There's nothing greater than seeing someone, start to heal.
Yeah.
I mean, it's a true utter pleasure.
It's
a great thing.
So with that being said, what's something that you would give advice to someone in regards to really anything you do? It could be on the cranial sacral, but it really could be anything that you'd want to share with the audience.
Well, as you said, I do a lot, and the idea is to get things done, and I've been practicing, I started medical school in 1998, finished in 2002, and I've been practicing through the middle of medical school all the time, so developing different techniques. So it's hard for me to say, any one specific thing, but keeping it to cranial sacral therapy, what's beautiful about it is I don't need a diagnosis. I don't need to take notes. We don't need to get into all the psychobabble of medicine. It's just tuning into the body rhythms, freeing up, adhesions in some of those structural components of the central nervous system, such as the cranium and the vertebrae and the sacrum, and allowing things to flow in such a way that the body can utilize its resources to heal. And it's just, I love things like this just because you don't need a diagnosis. I don't need to go through all the legwork of medicine. I don't need to make people spend huge amounts of money on functional medical testing to assess the best possible treatment based on that interpretation. So, that way you can kind of taste it and see if it works for you. And then you come in for a $25 appointment. If it's doing something for you, then it's something that you want to continue with. And it's only a $25 investment. And then from there, it's a lot easier to say, is this something that has value to me? Because I'm never going to put you in a position where, trying to usurp your finances. I want you to make the decision for yourself.
Absolutely. So $25, guys. Call, get on the website, call them 949-444-4884, holisticsolutions.doc.com, and check out just a multitude of things that he has. Dr. Dubroff, thank you again really for being on the show. And like I said, there is so much that you do, and, it's just your heart is in it, the passion's in it, and it's amazing, and I really appreciate it. So thank you.
Thank you.
Yeah, you're welcome, and thank you. Oh, yeah. I'm looking forward to next week, too. Really, I'm really interested in that one.
I don't even remember what we're talking about next week.
Oh, well, I'm going to announce it. I'm going to announce it. So thank you all, for everybody who's joined us out there today, who will be joining us via YouTube. We thank you. Please follow, subscribe, comment, and like us. And you can join us next week, July 6th, for our next show, The Bioelectric Body Electromagnetic Theory of Healing with Dr. Dubroff next week. So thank you again. We appreciate it. And thank you, Dr. Dubroff. I appreciate it. We'll see you next week.
Thank you, Linda.
Thank you. Bye.
Bye.